Good morning, everybody. I am going in to see my fertility specialist today. So I've just jumped in the car and we're just about to head off. So I'm excited to see what she says. I am expecting to get the results of my antral follicle count scan today, as well as see if she wants me to have any more blood tests or anything. Hopefully, fingers crossed, a treatment plan, because I'm really hoping to do my egg retrieval in July, because I should get to the top of the donor list in June. So that's what I'm hoping for, but let's just see how we go. I just finished my appointment and it was actually really positive. She went back over all of my blood work and everything is completely fine. All of my hormone levels are fine. My AMH is 23.7, which is actually really good for my age. It's well within the normal range, which is super good news. My antral follicle count scan, so she got those results back as well, and that was also really good. So I think on the left was 16 follicles and on the right was 20 follicles. As she was going through the talk with me, she said that she would expect to get around about 12 follicles with the egg retrieval. So with the breakdown of that, with sort of the stats, if you get 12 eggs, 7 normally fertilize, and you get 3 good embryos. I don't know, we'll see. We'll see what happens, but that was all super positive. And then she went through the protocol with me, what she would like to do for the stimulation, the egg retrieval cycle, and we did a timeline. So I was planning on doing the egg retrieval in July, so I have actually taken already 3 weeks off work in July, because I'm only meant to get to the top of the donor list in June, and I didn't know if it was, I didn't want to be stressed about, not missing the stimulation cycle because I wasn't at the top of the donor list yet. So I just thought I'd just do it a month later. And it turns out that she's actually away for 3 weeks in June, and she gets back the day before I go on annual leave. That all coincides really well with the timing of everything. So that has all just worked out really perfectly. So really happy about that. I was a bit nervous that it wasn't going to work out. But so we're going to do the egg retrieval in July, the middle of we'll start the injections and everything around between day 2 and day 4 of my cycle, which is sort of mid-July, which is right around my birthday actually, which is quite exciting. And she went through all the medications again with me, which she had already gone through with me before, and I've done a bit of research around everything, and so I kind of know sort of what to expect. We talked about doing genetic testing on the embryo, so she went through my risk analysis according to my age of how likely it is for me to have, sorry, it's super bright. It's a really beautiful day. It's really bright in here. She went through my risk profile of my age versus how likely I am to have chromosomal abnormalities on any embryos that I get. And so according to my age, there's a 43% chance that I could have an affected embryo, which means there's a 57% chance that I couldn't. So it's very sort of in the middle. Anyway, so I know genetic testing is really expensive, but I've opted to have genetic testing on all the embryos because I just don't want to, I want to do everything I can to not have a negative outcome. I mean, I know that you can't guarantee anything. As a midwife, I'm very aware of that. I think I would regret not doing it and then potentially having a negative outcome, or just being really anxious and waiting for all the testing to be done while I'm pregnant, and then the thought of potentially having to maybe terminate or something not going right. I just would like to cover all bases if that's something that I can do. So yes, it's an extra cost, but I spoke about that with my doctor, and she said, look, the extra cost is there, but it sort of works out, because if you were to have a miscarriage anyway, I'd have to do another transfer anyway, which is another like $2,400, whereas the testing's only it's like $900 per embryo or something. So, you know, just tack it on to my bill, it'll be fine. So that's been a lot of the positives with my testing and everything, and the timing of the egg retrieval cycle. So the negative is that I am CMV negative. So CMV is a virus, cytomegalovirus, that a lot of children are exposed to. And if you have the antibodies, like if you're CMV positive, it doesn't really mean anything. However, if you're CMV negative like I am, and you've never been exposed to this virus, and then you get a sperm donor who is CMV positive, there is a very low risk of the virus passing through the semen and then affecting the fetus, and then obviously the developing baby. And it's not something that can be tested for. Like, you only find out if the baby's affected once they're born. So the main things that are affected are hearing and eyesight. So they're normally like deaf and blind. So I was very aware of that. So like when I was going to be choosing a donor, one of my things was I wanted to have a CMV negative donor. But what I've just found out today is that the clinic that I'm using and the local donors that I'm using, they're actually not tested for CMV, which kind of threw me a little bit. And I think I just need to process that, because it was something that I was like really concerned about. And I know like with my other clinic, they test all of their donors for CMV. So now I'm just like, ugh. Anyway, is it important enough? Is it high risk enough for me to go back to my other clinic, is basically what I'm thinking. Anyway, my doctor basically said, look, they've never tested their donors for CMV. If they had recurring issues, like, it would have been addressed and it would be something that they would be testing for. But she said there's just such a low incidence of it happening from a sperm donor that they basically just don't see the need to do it. Anyway, something to think about. So I just wanted to jump into this part of the video really quickly while I'm editing it to say that I have actually recently been to a midwifery conference and got to listen to an amazing researcher who literally does this for a living. Like, she talks about CMV, she researches CMV. So I did actually ask her the question. I asked her, what is the risk of a woman who is CMV negative, who then either has a partner or uses a sperm donor who is CMV positive? And she basically said there's been no research done on that, because it's a virus passed on through bodily fluids. And that virus is most often found in toddlers who are in preschool. So she basically said there's no research around whether it's transmitted via sperm. I don't know why my other clinic tests for CMV if there's no reason to test for it. If there's no research around it, I don't know what the evidence base is for them to be doing that. So anyway, so I've put it to rest. And she said basically not to worry, just while you're pregnant, try and stay away from toddlers as much as you can. But like I said, I will do another video on it. So that's at least put my mind at ease, and hopefully it's something for you to think about as well. So that's the only negative. Then the next positive is I wanted to talk to her about doing a frozen embryo transfer instead of a fresh transfer, because of all the research that I've been doing, it seems that there's a higher pregnancy rate if you don't do a fresh cycle as soon as you've done the egg retrieval. Like if you do the frozen transfer like the next month. Talked to her about that, and she said that is true. Like, there is a higher pregnancy rate with the frozen cycle, because the embryos that are frozen are generally like really high quality, whereas with a fresh cycle they tend to use the lower quality embryos first, because they tend to not survive the freeze thaw process as well. So there's like a lower chance of having like a successful pregnancy with the lower quality embryos, but obviously like you still can. But she did say that the chance of having a successful pregnancy is higher with the frozen cycle. So she was happy to do that. I was worried because when I spoke to my counselor last week, she said that with this particular clinic, when you use a local donor, which is what I'm going to be doing, they don't tend to allow you to do a frozen cycle because there's so little donor sperm available that they want to guarantee basically they want to guarantee that you're not just going to freeze your eggs and never use them, and then that's like a family allocation that's been taken up. I don't know why you pay all this money and like not like go through with it, but anyway, that was her reasoning. So I spoke to my doctor about that, and she said no, if there was like a medical concern about doing a fresh transfer over a frozen transfer with local donor sperm, then that is totally fine. So I did say to her, another reason that I want to do a frozen transfer is because I'm concerned about how my body is going to react to the hormones from the stimulation cycle, because I get really bad PMS just on a like generally, and I get really emotional, and like I struggle a little bit every month. And so, you know, with all of these extra hormones and things, I'm just concerned about how well I will cope, especially because I'm doing it on my own. So I spoke to her about that, and she said, look, that qualifies as a medical reason to not do a fresh transfer. So she was like, that would be fine. And she went through like the grading system, which is like super easy to understand. Like I've seen some that are like super complicated. But this is literally just like ABC is like the cell development, and then it's one through 6. So 1 being the worst and 6 being the best in terms of like cell splitting and stuff. So if you have like an A6, that's like the best. So she said because of my AMH levels and my follicle counts and the fact that I've got no other like health history or anything like that, that she would expect me to get like a good amount of really good embryos. So look, fingers crossed. I don't know what to expect, and I don't want to like get my hopes up too high, but I really want to get excited. Now that I'm in the shade, I can say hello to you all. Then the other thing that I wanted to talk to her about was doing a natural cycle. So instead of doing like a fully medicated IVF cycle, which I just wanted to try and avoid after like the whole egg retrieval hormone cascade that's going to happen. And because I'm so regular and I know that my body works, so I asked her about doing a natural cycle, and she was like totally on board. She was like, yep, I do that with most of my patients if I can. It's a really good way just to use your own hormones. She said the only thing that she would sometimes do is do the HCG trigger shot, which kind of gives them slightly more control over it. But she was like, we don't have to do that. So I just said, look, I would prefer to do like the most natural thing first. But I did say to her that I do know that I don't ovulate every month, which is very normal. But I'm aware that that doesn't happen for me. So I did ask her if I needed to make that decision now about the HCG shot, or if I could wait until like the actual cycle. And she said, no, we can definitely wait. So what'll happen is I'll just have a bunch of blood tests done on the days that they're needed, and they'll wait for the LH surge. And if I don't get an LH surge, then we can do the trigger shot. But if I do get an LH surge, then we won't need to do the trigger shot. So yeah, so that was all like really good news. I'm like super happy with that. Now the next step for me is just to wait until June. when I get to the top of the donor list. And she said once I'm at the top of the donor list, they generally want to start treatment within 6 weeks, which is fine. And I just pray to all of the gods that, like, I find a donor that I like. Now that I know that the CMV status is not something that I can change, I guess my only, 3 criteria would be that the donor needs to be Caucasian, he needs to have light colored eyes, so like blue or green or hazel eyes. So many people have brown eyes, and it's just not something that's in my family, unfortunately. So, you know, I just don't want someone with brown eyes. And be cystic fibrosis negative, because I'm a cystic fibrosis gene carrier, so he can't be anywhere near the cystic fibrosis family. Anyway, I'm now going to get my hair done and just generally be happy that this is all on track and going exactly how I thought that it would go. And fingers crossed it stays that way. But look, this is the best I've felt in a few weeks. I've really been struggling the last few weeks with my mental health, like, quite significantly. So this is good news. Like, I needed to have good news. Anyway, that's it. I'll see you later.